So when we talk about mastering attachment placement, we want to make sure that you understand exactly how all of this plays in role to. One of the most important things to understand when we're placing attachments is that I take it very seriously. When we go into our hands-on components of this learn, we want to make sure that you understand exactly the process. When we think about the process for delivering aligners, we want to make sure that you also know, from start to finish. And if you're jumping right into this learn and you really don't have an understanding of, doing the consult, to the records, to delivering the attachments, to delivering our retention, then I really want to encourage you to maybe go back and go into our aligner therapy learn, which is the full on becoming the Invisalign course. This course is really only focused on aligner delivery because most people already know the process. So when we think about that, we think about case submission, the treatment plan. You may or may not have placed attachments before, and that's fine, but you do understand the process. And then also monitoring the treatment, removal of the attachments, and then delivering our retention. Our main focus is really taking you through how to place those attachments and most importantly, making sure that you do them correctly. I've delivered at this point in my life thousands of attachments, and I can tell you that I've taught over 60,000 dental team members, and I know firsthand that not everything we do is right. And so I'm going to share with you throughout this program the good and the bad, okay? And that's something that's really, really important. But the first step is for us to understand the types of attachment shapes, because if we don't understand the shapes, we have to really think about when we're filling that attachment template, which we will be doing in the hands-on, these shapes and you knowing what to look for is so imperative. When we think about brackets and wires, putting pressure on the teeth to move them, that is exactly what these attachments are doing. We're putting composite on the teeth to put pressure on the teeth to move them. So there's three different types really that we're focused on when it comes to attachment shapes. We have rectangular shapes, that's used for tipping and torque control. We have our oval shapes, really for minor movement, or what we call rotations, minor tooth movement. And then we have our beveled. And beveled is really based on really the software that is within Invisalign. And this delivery is really based on Invisalign treatment and really generated through their design. When we think about what are the common reasons, why do the attachments come off? What are the reasons behind that? Well, first of all, the number one reason is always isolation. And as a dental team member, most people are going to be dental assistants taking our learn, that you have to understand this is direct bonding. When you're doing direct bonding with your dentist, or maybe you're an EFTA and you're doing it yourself, we have to have proper isolation. This is the same concept. We are doing direct bonding. So we have to have moisture control. We have to control the saliva. Cotton rolls just will not do it. And so we have to make sure that we're using proper isolation. The other thing is that some patients come in and they've got plaque buildup on their teeth. They may have, poor surface preparation. Now that can mean a lot of things. That could be that there was plaque on the teeth, so we want to make sure that we're utilizing some pumice. Or some dentists will even micro etch the teeth before they place the attachments. I don't do that. I like to use just pumice preppies, and I'll use that just to pumice any areas that I feel that maybe the patient may not have brushed really well. But most importantly, we're going to refer to prepping the enamel. That means the enamel is not etched properly. So we're going to talk about under etching. The other thing is that underutilizing or maybe misusing proper bonding agents. When we think about adhesives, you really don't want to use a self-etching adhesive. You can use a universal adhesive. That's what we're going to be utilizing today. And we don't ever want to mix match materials. One of the things about this box and partnering with the manufacturers that we partner with is we never ever mix materials. This is where we see failure. And as a dental assistant, this is Education 101. Any of the learning modules that you will get from me or my team, you will always be told we never mix manufacturers' materials. Bonding agent from one manufacturer, just like Avoclar, is made to go with their composites. So we don't want to mix match those materials. The other thing is that we want to make sure you're using a proper heavy body composite. The more complex the case will be, you will have more attachments on one single tooth. It can be anywhere from one attachment to 3 attachments, sometimes 4. Yes, I've seen 4, only once in my lifetime, but 4. And this is where, when we think about placing attachments, we can't use a wimpy, flowable composite. We have to use a very heavy composite, and one that is highly filled and really designed for attachment placement. And this is what you're going to be utilizing today. The first thing, too, is we want to make sure that we are familiarizing ourselves with those composites. Now, one of the things that I always want to make you privy to is that Invisalign had hired myself and my team for 7 years. We taught over 60,000 dental team members, and part of our hands-on was placing attachments. So when we think about that, I want to utilize the best attachment material. And there's lots of really good materials out there. The one that we're going to be utilizing, the one that I utilize in my own practice, is Tetric Evo Ceram Aligner. It was made for attachment placement. We're also going to talk about isolation. We're going to get into adhesives and utilizing a really good, great cure and light. That is the most important part, and that's part of a learn that's separate from this one, is making sure that we're utilizing really good cure and lights, because the last thing you want to do is undercure these composites. And if you're utilizing a really good cure and light, we won't have to worry about that, right? Now, in my next slide, I'm going to take you through, this is a video of just taking you through all the materials that we're utilizing here. Here we have lots of products that are within your hands-on kit, and we actually dive deeper into this when we get to our hands-on. But basically, what I like to do with all of my assistants is I like to set up my room completely, and I will take photographs of my setup. And so these are the products that we'll utilize in the hands-on, and most importantly, we're going to utilize for every attachment delivery. Having our isolation, make sure we're utilizing the right instruments. You'll hear me talk a lot about the Optrosculpt instrument, or what we would used to call the OptraPad. Utilizing contact ease, we have little instruments that we can use for interproximal reduction. Interproximal reduction is where we go in between the teeth and we actually remove a little bit of enamel. Now, that is illegal for a dental assistant to do. That is what the dentist has to do. And then we're going to talk about having great properties where we can actually see those attachments. And then utilizing, sometimes we have to utilize bite paper. There have been times we've had to do a little bit of a bite adjustment. And most importantly, utilize something like troll foil for that. So let's jump right in. Why are we utilizing Tetric Evo Ceram Aligner? It's really because it is clear, it's translucent. It mimics natural tooth structure. And one of the things that you will find as you do more and more cases is that these attachments will be placed across the patient's front teeth. And there are some patients that are really scared of that. There are patients that my team forgot to tell them that we were placing attachments across their front teeth, and they freaked out, So this is where, we don't have to worry. And the beauty also of this product is that it doesn't change color. There's a lot of composites out there that will stain and pick up color, where this one, again, is going to mimic natural tooth structure. So if we do decide to do some type of whitening while we're in our aligners, we can, and not have to worry about little bubblegum yellow attachments, right? So here we want to make sure that we're using good products for that. We get through when we start with starting our treatment. Now, the patient has already gone through all the records. We've submitted the case to Align. The doctor has approved the ClinCheck, and now we are ready to place the attachments. As a dental assistant, it is something that is protocol in my practice. We have to look at the patient's ClinCheck, familiarize ourselves with the ClinCheck. Even after the doctor does, I'm still looking as the dental assistant because I'm kind of controlling in that way. But 2 days prior of placing those attachments, we want to familiarize ourselves exactly where they're going to go. One of the other things that I like to do is I like to make sure that I know exactly where those attachments are going to go and what is the shape of those attachments. Now, when you open up your box, which we're going to talk about when we get to the hands-on, you will see that the beauty of Align is that they give you every step of the way. They tell you everything that's going to happen, when it's going to happen, how many aligners you should be delivering, if you're going to do interproximal reduction, and most importantly, discussing that compliance. And we'll talk more about the compliance. And if you ever want to have compliance indicators, which are little blue buttons that we place on the teeth for those patients that we might be leery of actually wearing those aligners, we can do that. Now, we talked a lot about the Tetric Evo Ceram and that one universal shade, so we don't really have to worry so much exactly when we talk about those front teeth. And again, just having something that's translucent really helps to make sure that patients don't have a panic attack in the chair, right? When we look at the ClinCheck, now ClinCheck is basically a simulation of exactly where and how those teeth are going to be moved, but most importantly, where the attachment is going to be placed. And one of the things that I like to do with my patient is I will actually print out for my team exactly where they're going to be placed. I actually print a right and a left. And so you will actually have this in your box. So when we get to your hands-on, you'll see what are we doing on the right side versus the left, where are those attachments going to be placed, what teeth, because sometimes we don't have access to our ClinCheck. We might not be able to log in and see on myitero.com exactly where they are. And this happens a lot with a lot of practices. So when we open up our box, Align only gives us these shape of squares where the attachments will be placed. So they really don't give us the shape, which makes me angry sometimes because I wish they would. So we really got to know exactly where they're going to be placed, and most importantly, what is the shape. And also we can look at our attachment template too, right? So let's talk a little bit about the process. Let's walk you through quickly exactly how all this is going to be done. We're going to use proper isolation first. We're going to go through all the steps. And most importantly, we're going to share with you how everything is done. So in your hands-on, ideally we would place our Optigate on our patient, make sure everything is nice and clean on those teeth, no debris, no plaque, no buildup. We would also want to make sure that when we get into our hands-on, we're going to acid etch only the area where that attachment is going to be placed. And we're going to acid etch for 30 seconds on each tooth. And we'll get into on the hands-on, when do we suction everything off? Because remember, if we set a timer, we want to make sure that we know each area is nice. We rinsed it. It's frosty. It has a sealant-like frosty appearance. So this way, when we dry the teeth, we're going to scrub in that adhese. We're going to make sure everything's nice and dry, and we're going to cure with our Power Cure Blue Phase Light. So we want to make sure everything is done correctly. We're going to place our composite right into the attachment template, making sure we pack that composite in with our Optrosculpt. And now we're going to seat that attachment template onto the patient. Now, I like to preload mine. We'll get into that in just a minute. And as we seat that template, we're going to trace around each attachment with our instrument and cure. So let's jump right into it and let's do a recap, okay? Because I'm a soft talker sometimes, but I'm also a very fast talker. So the first thing we want to do is we want to try in the template, make sure it goes all the way down, make sure it fits, and most importantly, making sure that we try in the first aligner. That is imperative, okay? Making sure everything looks good. We don't see a whole lot of space. We call it window. And making sure, again, it goes to place. And we're going to try in both templates, upper and lower. Now, when we look at exactly where, again, we're trying everything in, we make sure that we try in that first aligner, the upper and lower attachment template. And what we're going to do is put that first aligner back into the bag. We don't want to get those confused. This is where sometimes we'll have team members that will get confused with, again, each one and end up using the first aligner for the attachment placement. So we definitely don't want to do that. And we'll go through that when we do the hands-on. One of the things that I like to utilize is a product that actually I helped invent. It's called the Prepster, and it's by Hager. And Hager basically took this product on. We were looking for a distributor. I love utilizing it because it really helps us to organize dental restorations if we're, having multiple restorations placed, but I also use it for my aligners. And one of the things that I like to do is I will actually preload, and you saw that in the video, and we'll get to that here in just a few minutes, but it is a great product. It's autoclavable. It has a lid on it. And I like to show that, and you'll also see this. We'll put that into the Learn where you'll have the information on that if it's something that you want to maybe check out. And again, you'll see it here in the video in just a few minutes, exactly how we're utilizing the Prepster. So first thing we want to do is we want to go back to kind of the original video that I gave you an overview first. We're going to only acid etch the areas of where those attachments are going to be placed. And the reason that you only want to acid etch the areas where they're going to be placed is because when we acid etch the whole tooth, and I can tell you probably 90% of the population acid etch the entire tooth. And then we end up nitpicking off all the resin in all these areas, and it makes it really tough for us as dental assistants to make sure that everything's nice and clean. Well, the beauty of only acid etching, and this is why you either want to print out your, your ClinCheck, which you can do, and I've got a little video on how to do that. Or you can have the ClinCheck up, and looking at the myiTero.com to make sure that we come really close to exactly where those attachments. And again, we're not perfect, but we want to try to come close to that, right? So this is something that, again, you'll see here. Now, this is an acid etch from Ivoclar. I love all Ivoclar products, but I have to be honest, this is not the one that I utilize the most in my attachment placement. I like using Ultra Dense Etch because I feel like it's a little bit easier for me to squeeze out and know exactly, because sometimes with, we all know with this blue etch, and it's pretty much, I think one manufacturer makes it for everybody, when you squeeze it, it just goes everywhere. So I do like Ultra Etch here for this reason. Now, my doctor is very, very picky about utilizing a timer. And I can tell you that when you think about 20 seconds or 30 seconds, whatever the manufacturer tells you, that's when you want to set your timer. But if you start rinsing off when the timer goes off for those first two teeth, remember, we're going to under etch the rest. And so for me, I don't worry too much about, I set my timer honestly when I've acid etched the last tooth. And I want to make sure that things are nice and frosty. Here I'm utilizing the Optragate 2. Which is from Ivoclar. I cannot work without this product. And this is why. You see, as I'm trying to dry everything off, if I try to use cotton rolls, oh my gosh, I've been there, done that. I'm too old for that. I'm not going to sit and wrestle with a patient and wrestle with that tongue. I want to make sure things are nice and dry, and this really and truly is the reason why we just don't have attachments coming off. But you'll notice everything is nice and frosty, right? Nice and frosty. If it is not, we have to re-etch, okay? So we would go back and we would re-etch. Now, after we've acid etched, we're going to dry everything off really good. We're going to utilize our adhes. Now, in your hands-on booklets or your hands-on box, you have universal. Now, one of the things that we talked about was utilizing, you don't want to use a self-etching product. You want a universal bonding agent. And again, we don't mix manufacturers' composites because we love the Tetrix. So I'm going to use Adhes Universal. And I love it because it's in a pin. Now, the downside is this is very, it's costly for us. We have so many people doing hands-on that I couldn't buy it and give it to everybody. But hopefully some of you are utilizing this in your practice already, or you may have a Unidose, but I absolutely love it. Now, when you think about utilizing a bottle, one of the hardest things for my doctor was for him to say, yes, we could use this, because he felt like we were wasting material because it was in a pen. Well, that is actually the exact opposite. This is an amazing product, and I can tell you that you can have over 170 patients, 170 applications. So here I'm going to scrub it into all those areas. And remember, this is not a mop. Some bonding agents, you actually mop it on or you paint it on. This is a scrub. And we're going to scrub it in every area that we place. Again, every area we etch, every area where that attachment is going to go, we're going to scrub it in for 20 seconds and light cure each area. Now I'm going to go to my Tetric. Now I told you I like to preload. After I've done my try-in for my template and my first aligner, I will preload this and put it into the Prepster. Here you'll see I've done that. I've got all of my material. Now I am actually going to back up and I want to just kind of show you this again. When we are, again, loading the template and acid etching, we've done our bonding agent, we've placed our composites in the template, we're going to seat it all the way down. When we seat it, we want to make sure we see no daylight. That's what we call a big space in between where the tooth and the aligner go in. We want it down all the way. Now, the template is very flexible, so you've got to kind of be a little bit aggressive. Again, utilizing that retractor from Ivoclar, the Optragate, really helps us. We're going to take our instrument, our OptraPad, and we're going to trace the outline of every attachment. Now, why do I do that? You say, Shannon, why do you do that? Because what we find is that when we seat the attachment template onto the patient's teeth, some of the composite will actually squeeze out. By tracing the attachment and going around it with the Optra pad, we find that it actually kind of scoops that composite back into the attachment window, which is what we want. And so this is where I'm going to go around and I'm going to trace every tooth and just make sure it's down all the way. And now we're ready to cure with our Blue Phase Power Cure. Now, I'm holding it down. You'll see I'm holding the attachment template down and I'm curing every attachment. Now, this is a high intensity power light. It's only 3 seconds. So some of you may have a cure light that needs to be in the Smithsonian or might have 10 layers of composite on it. So make sure that whatever cure light you're utilizing, that you're utilizing again and holding down the template. And you'll see me do that. And we'll do this again in our hands-on. After we've done the final cure, we're going to remove that template and making sure now that I actually jump to, and I'm going to pause it for just a minute. You say, Shannon, you're cheating. I am cheating. Because you know why? I don't want to have to take this off. Now remember, when we removed the attachment template, I did not acid etch the entire tooth. So the reason that I didn't etch the entire tooth and actually use the adhese exactly where I acid etched the tooth, I don't have a whole bunch of flash and a whole bunch of cleanup. That's the beauty of utilizing the adhese pin and only acid etching those areas. So when I remove the template, I jump to my Optra polisher, and I'm going to go back just a little bit. I call it a sunflower. That's what it looks like to me, but it's the Optra polisher, and this is the one, again, that's shaped like a sunflower, and I will use it before I even jump to a scaler or a Explorer. Why? Because it kind of cheats. It removes a lot of that excess flash. It's a rubber polisher. This is from Ivoclar. I absolutely love it. And we can polish with the little sunflower, and then I'm going to jump to our bullet. Now, you'll see me, and I'm going to back up here as I'm polishing. Notice I did not touch. I'm only polishing around the attachment. I had a dental assistant one time that said, well, Shannon, we don't want it to be really sharp for our patients. We want to make sure that when they do take off their aligner that, it's not sharp to their tissue. And I said, what do you mean? The ultimate goal and the only way that we are going to have movement and get to those exact movements that Align told us we would have is because we're putting pressure on the teeth. And when we take a polisher and we polish all these areas, the patient might be more inclined to not wear their aligners. And I'm going to tell you, that's not me. That has been proven. So, patients that tell you that it's sharp, oh, it's cutting my gum tissue. Well, guess what? You shouldn't even know that because you should be wearing those aligners. But what I'm doing is I'm taking the polisher and I'm just removing the excess flash, the excess adhese. It's super easy to do. And yes, I do cheat a little bit because I want to go around and make sure that, again, I don't have a whole lot of excess flash. Now, I'm going to back up just a little bit because it went too fast. We're going to remove, again, the attachment template. We're going to jump to our Optra polishers or Optra gloss. And now I'm going to shine my light. I love utilizing Tetric Evo because of the fact that I have this fluorescence. We're going to shine a black light, and I'll show you where to get it. But you'll have a little black light in your kit, and we're going to shine in the patient's mouth, and this is what's going to allow us to see where the excess resin, are there areas maybe where I had excess composite that maybe we did not get off. The beauty of Tetric Evo is the fact that we can shine a light at any given time. When a patient comes in for us to deliver the next series of aligners, I will basically shine the light in the patient's mouth to make sure that they didn't lose any. Now, the one thing that we told you was that Tetric Evo is clear, it's translucent, and there will be times that patients may not even know that they lost an attachment. This is why this is so critical, and most importantly, it's the best piece and the best thing about Tetric Evo. So here we're able to see this with Kennedy, and we can light up her mouth, see any excess resin, and yes, there was resin, so we had to go around and polish some more or take a scaler, remove it. Sometimes the doctor has to take a little ET carbide. And then what we're going to do now is we're going to go around every attachment with Servitech Plus. Now, this is something that nobody does. You say, Shannon, why are you doing this? Well, first of all, remember that when in our treatment plan, if a patient has to do, or the doctor has to do interproximal reduction, if the doctor has to do interproximal reduction, we are removing some tooth structure. And remember, that is not something that a dental assistant can do. It is against the law in every state. We cannot use interproximal reductions. We're using the contact ease to go in between and make the teeth just a little bit smaller. So this way we can get movement. And patients will come back and tell me that their teeth are sensitive. But the main reason that I'm doing it out of the gate is because Cervatec Plus actually is an antimicrobial. It also helps desensitize, and it's going to clean off any areas around every attachment and really seal those areas. Remember, we acid etched, we did bonding. I love Cervatec Plus because it also is not like your typical fluoride. It's not goopy, it's not sticky, because the last thing that we want is for the patient not to have a reason to put back on the first aligner. This is more like water, but what it does is it's going to clean off all the areas of where the attachment's going to be placed, and most importantly, help desensitize. So again, I'm removing it, we're polishing it, we're going to go with our polishers here, and we're going to use our Cervatec Plus to make sure that we, again, and I love this brush. Oh my gosh. I mean, you will too. I'm going to tell you. I go around every attachment and I tell patients, hey, we're going to protect these attachments, make sure we don't have any plaque buildup. We know about brackets and wires. Sometimes we have these little white spot lesions. You just won't have it with utilizing this desensitizer. And the other great thing is, remember, whenever we're talking about insurance, and I do teach a lot of insurance courses for Align. It's not part of this segment, not part of the hands-on, but it is something that we do teach. And if a patient comes in, let's say in 2 weeks or 3 weeks after they've maybe coming in for the next series of aligners, they take out their aligner and they tell me that their teeth are sensitive, we can utilize a code and code this, walk it out, and we see anywhere from $16 to about $22. Some people have gotten a little bit more of reimbursement from the general benefit. Now, I'm not going to go through the orthodontic benefit, right? Remember, orthodontic benefit is a maximum lifetime. General benefit actually comes back around again every year. So anytime that I can take money from the general benefit, I'm going to do that. And this has coverage because we're utilizing the D9910 code. And again, every time. Now, the one thing about Cervatec is it will last about 3 months. So if the patient is still sensitive, 3 months, and maybe it's a longer case or a more complex case, you can have another application, document where you placed it, and we can walk it out and we can charge the patient. This is where we make money, right? We make money and not give things away. Now, one of the things that you have in your box is that you're going to have a step-by-step guide. I am all about downloads. I'm download checklist. I like having a setup. I want you to have everything that you need. And most importantly, I want you to have a map to tell you everything to do. Once we have this and it becomes, elementary to us, but what I do in my box, which you'll see, is I actually print these out for my team, and anytime that we have someone new or maybe has only been placing attachments for a short period of time, you've got something to utilize. And that's what I love about this graph here. And download this, print it out, you can give it to your team members. It's a part of the treatment plan. Now, let's talk about what happens. Now, a couple of scenarios here that you can do. In my practice, we like to deliver the first aligner and not place the attachments until after the patient has worn the aligner for about a week, getting used to the aligner. Then they'll come back and we will place the attachments on. That's just the way my dentist likes to do it. My other dentist, my orthodontist that I work with and partner with, he likes to go ahead and deliver those attachments right away. We don't want to play around. But one of the things that we like to do is, in my other boutique practice, is that we like to give the patient whitening, and we will actually do the whitening out of the gate. Why do we do that? Because what we have is sensitivity, and it's a common denominator. I've whitened about 4,500 patients. I can tell you from this day, the common denominator for sensitivity is orthodontics. And so one of the things that I'm really pushing my practices is trying to do the whitening out of the gate. And it's something that instead of waiting till the end to celebrate, what we find is we have better compliance. We got more patients doing aligner therapy and doing what they should because they're using their aligner for whitening. And so it is really one of the best ways to do whitening, and again, doing it right out of the gate. But when they come back, we want to monitor the treatment. And so some practices will give 3 aligners, some will give more. We really follow the ClinCheck because we're a general practice and we like to follow the rules. We're also very protective of our patients. You don't want to give these patients too many aligners, because what happens is if you give them too many aligners, we lose track of where they are. And if they're not compliant, then guess what? We have to rescan and start with mid-course correction. And I don't want to do that. And so we try not to give too many aligners. We usually give about 3 at the most to our patients. We try to follow the treatment plan and really do the best we can. But one of the beauties of having the treatment plan is it's going to tell us every step of the way, right? But again, knowing that those attachments are not square, they are, again, shapes. We need to look at that. Now, nobody really talks about bonding porcelain. And one of the things that we do have after you close out of this is we actually added a little video on placing an attachment on porcelain. And again, what I love about Ivoclar is the fact that they have no reason to not talk about anything, right? Because again, they're not scared. They don't want to tell somebody something. They really and truly want to jump right in and make sure that whenever we are bonding to porcelain, we know exactly what to do. And there's a couple of things about that is, first thing is that if we talk about porcelain, one of the things that my old dentist used to do is he would sandblast the whole entire tooth. And here we go again. We're removing that beautiful shine, remove the glaze. We cannot put the patient's head back in the oven. So we want to make sure that we micro etch only, a small area, or we can use a little small round diamond. And using that round diamond is what's going to allow us to really only roughen up the area of where that attachment is going to go. And that is something that I want you to really pay attention to. If we have an area where an attachment came off, let's say it's on natural tooth structure, I would utilize either a super snap sandpaper disc from Shofu, which you have in your box, or I would utilize a little ET carbide. I would have my doctor kind of roughen up that area because it's very hard if they lose an attachment to just go and acid etch that area and rebond. I want a clean surface again to bond to. And something must have happened. It could have gotten wet. Patient could have been taking these on and off. But this is why, again, it's so important when we get to the hands-on to make sure that you're utilizing a very heavy, strong, composite, one that has a lot of strength, heavy body, not some wimpy flowable, heavy body, which you'll be able to feel it when you go to place it into your attachment template. But one of the things that I want you to really think about is wear and tear. One of the things we know about composite is it does wear, just like natural tooth structure, and we're putting a lot of pressure every time the patient is taking these attachments off and on, the aligners off and on, they are causing wear and tear. And again, going back to the more complex the case is, the more wear we'll see, and also the potential when we're using these wimpy composites of that attachment coming off. And sometimes the patient will actually pull it off, So again, I want to make sure you know how to put it on, and we're going to utilize not the same bonding technique for porcelain as we do for, again, enamel, right? We're going to acid etch the teeth. We're going to use, again, our etchant for that. But here we're using Monobond Plus, and this is basically treating the porcelain so we can then use our adhes and place that attachment on that area. But we got to treat the porcelain. It's not the same as treating, unetched enamel, right? You want to understand that. Now, making sure, again, every time that we are delivering our aligners, that it's going down all the way, we're not seeing a big space. If we do, then something is wrong. We got to talk to the doctor. We want to make sure that, hey, we make them aware that it seats all the way, there's no gaps, and making sure that those attachments are engaged. Making sure, again, a lot of times when we feel like the teeth are not moving, there could be a lot of reasons for that. We underfilled the attachment template, so we didn't put enough composite in that template to put movement on the teeth. And for me, I feel like that's the number one reason why we don't have movement like we need or what we should be seeing. So we want to pay attention to that. And you say, well, Shannon, I'm just an assistant. No, you're not just an assistant. You are the one that is delivering these attachments. This is a very high technique sensitive procedure because we're bonding, right? So we want to make sure of that. Every time a patient comes in, and you'll see this in your handout, I'm checking in between every interproximal area. Now, there's a lot of speakers out there for Align that will tell you really only need to floss the front 6. That's not true. You want to floss every interproximal area, making sure that if there's any area that has a tight contact, we have a sheet and I will write down exactly where the tight contact is. So when the doctor comes in to check me, I will say, hey, he'll say, hey, is there anything I need to be worried about, anything that you pay attention to? And I'm like, well, it's a very tight contact between 24 and 25. When I floss it, it's very tight. I want to let you know, because remember, we're Invisaligns. We are not just a team member slapping some composite. We are doing a very serious procedure for these patients. We're moving teeth. And when we think about putting pressure on the teeth to have that movement, I want to make sure I'm letting my doctor know any area, because if we don't have space, we will not have movement. And sometimes they got to go back in with our contact ease and relieve some of the areas interproximally, just because of those contacts, making sure things are where they need to be. And again, checking every attachment. The beauty of taking a photograph of that screen, doing a screenshot, print it out, I fold it, I put it into the patient's box, and we keep actually our patient's boxes here. We don't give them everything to our patients. But I can go back and remember, or when the patient comes in, I can pull up their ClinCheck. That's the easiest thing to do. Pull up the ClinCheck at my iTero, and we're able to look and see exactly where are the attachments, what's the shape, and then we're going to shine our light in there, right? If we're using Tetric Evo aligner. So this is where, again, we want to make sure and we're following the treatment plan that Align has given us. So we're going to check the aligner fit. We're going to check the placement, make sure the shape is still exactly the same shape, that we didn't lose any of it. And if we did, then we're going to replace it. Or if we feel like they're worn, there have been times, I had a patient that's been in aligners for 2.5 years, and towards the last 3 months, those attachments were looking a little rough. So, you want to make sure of that. Again, checking those contact points, and again, making sure we've got tracking. What's the easiest way for us to know whether or not we have tracking is what? We're going to scan. If you have an iTero, which I know all of you do, you can scan and see if you are on track. And that really is the easiest thing to do when in doubt. Now, again, making sure that, everything looks good. We're trying our best to make sure the patient stays engaged, that the patient is wearing the aligners like they should every time, not just handing them the aligners over the counter. We're trying them in. We're making sure they fit every single time I see a patient. I'm also going to walk out all the aligners that I am delivering so my team knows if a patient loses one of their attachments. And let's talk about that for a minute, because this is where a lot of team members try to duel me. And listen, that's the reason why I am the teacher and you are the student. I have placed hundreds of thousands of attachments. I've taught over 80,000 dental team members. I am Align's #1 educated dental team member. I'm the very first person on faculty and the very first person to win any awards. I know what I'm talking about here, and what I'm telling you is, when you were on aligner 2, 3, or 4, you lost an attachment. Sure, go back to the original template. But when you are past 7, 8, 9, you never, ever use the aligner to place the attachment or use the original template. Now, why is that? Remember, the template is something that we're utilizing originally out of the gate to place the attachments. And the aligner is for movement. If you use the last aligner to replace an attachment, do you know what's going to happen? You are going to compromise the movement. So what we need to do is train our team up front. If they lose an attachment, and maybe they're on attachment number 15, like my daughter, she lost an attachment, and what we had to do is call or jump on myitero.com and order an attachment template at that phase. It takes about 2 or 3 days to get it, which is not, life-threatening. Patient will come in a few days once the template comes in, and we will replace the attachment at that phase with that new template. All right? New template. Do not use the aligner ever, 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 ever. And again, ordering the template at that stage. Okay, that's my soapbox. I just want to make sure that you are the very best at this, that you become the expert. This is so great for us as assistants. It's a time when I don't have to work with my doctor. I can work by myself. And this is for me. I love this, and I want you to love it as much as I do, but I want to make sure that you're doing things right. I'll never lie to you. Now listen, the template is sacred. You don't want to poke a hole in it. I heard one speaker one time tell people to poke a little hole in it so the composite can squeeze out. Are you crazy? You never, ever do anything to manipulate the template. The other thing is, I heard somebody using like Pam or Vaseline, so this way they didn't have as much flash. You are inhibiting bond strengths. Whoever said that, should never be able to lecture to another person ever as long as they live. The template is sacred. My team knows we never ever cut the template. The only time that I will allow it is if you're new out of the gate. I will allow you to cut it down the midline. So this way you can do one side at a time, but we never, remember, the template is sacred. The other thing is you never give the patient their own template. You never ever do that, okay? Now let's get into taking these off. Now, part of your hands-on is not going to be removing the attachments. That's a totally separate learn because there's a lot more to it than just removing it with a burr. But I want to share with you, this is the beauty of Tetric Evo. My daughter fell when she was younger, and we utilized Tetric to replace her class 2. As you can see here, it is lit up. Now, I had another dental team member just a week ago say to me, well, who would want something that is fluorescent like this? What if they go somewhere to a club or they go out? And I thought to myself, and I told her, I said, listen, I'm not trying to be smart, but can I tell you, not one person out of the thousands of attachments that I've placed ever told me they went to a club and their teeth were glowing. Nobody tells me that. Never, ever have anybody say that. For me, it's about the patient. It's about delivering a product that I can see, and most importantly, I know if it's debonded, I know if there's resin behind, and also we can see it. Now, one of the things that I will say about Dr. Corman, I love him, is he told me, he's the dentist actually removing the attachment. He said, Shannon, I had no idea how important utilizing a composite that I could put a blue light in and see it like this. He said, what it does though is it actually shows all the areas where he said, I wish I would have been a better clinician, because it's showing all my discrepancies. And I said, I know that, but you know what? It makes us better clinicians. And so this is where, again, looking at this and again, seeing the fluorescence, being able to see exactly how to remove those attachments. Again, I'll make sure that you have this. And I want it to be a little bit more. It's about a 15-minute learn, but here you'll see that it is something that, again, fluorescent. We can shine a light in there, and we have confidence knowing that we're doing things right. So without further ado, hopefully most of you or all of you have purchased the See in a Box kits, and now we're going to jump to the hands-on of placing those attachments. After you've learned and perfected placing those attachments, then we're going to teach you how to remove them, okay? So, again, hope you enjoyed this learn. Know that if you have any questions, maybe there's something that maybe you wanted to ask, you can do that right within our app, on the online. You can actually just click the little button here at the top as you exit out of the learn, and you can ask us any questions. We're always here for you, or you can email me at Shannon at chairside-assisting.com. And again, I hope you enjoyed this. I'm so proud of you. I'm so thankful that you signed up, and most importantly, get practicing, and then you will be that Invisaleader that I know you strive to be. I can't wait for you to do the hands-on. So we'll see you here in just a few minutes. We'll jump now to utilizing the typodonts.